Her report affirms the view that systemic racial discrimination extends beyond any expression of individual hatred, but also from bias in multiple systems and public policy institutions, including laws that perpetuate and reinforce barriers to equality.
The report highlights on the global health impact on racialized people of living in legacy of past and ongoing forms of racism, apartheid, slavery, coloniality, and oppressive structures, including the global economic architecture, funding mechanisms, and national health systems. It also sheds light on the impact of racism and discrimination, in particular on Black people, persons of African descent, migrants and indigenous peoples, and minorities, and the intersection of factors such as poverty and discrimination based on age, gender identity, expression, sexual orientation, disability, migration status, health status, and location in rural or urban communities.
She highlights, for example, residential segregation, which she calls a powerful predictor of health and well-being, pointing to residents of communities in which public health services are inaccessible as facing higher rates of preterm birth, cancer, tuberculosis and depression. Dr. Mofokeng explicitly states that in comparison with white majority neighborhoods, communities predominantly composed of peoples of African descent are more exposed to environmental toxins and air pollutants, which result in various preventable diseases. Take this National Institutes of Health study released in the United States this week, which found that white adults were twice as likely as black adults to receive life-changing cardiovascular therapies, including heart transplants, possibly due to racial bias.
Racism is linked to poverty and is present in multiple localities. It leads to exceedingly high rates of police brutality, poor access to justice and resources, mass incarceration, and a lack of access to housing, education, safe water, employment, and healthy food. Racism also leads to increased rates of mortality and morbidity.
She warns that colonialism and racism has shaped the norms of what is considered healthy, leading to what she calls the stigmatization of systems like body mass index, arguing it's been weaponized against black and indigenous bodies. Shervin Brycepease, SABC News, New York.